here, there is an easy access to so many more therapeutic diagnostic modalities that you wouldn't have back home.
Thank you so much, Dr. Pooja, for coming to our podcast. We're so excited to speak to you today. Can we start off by you explaining who you are, your background, where you come from, where you trained, and where you're working now?
Yeah, absolutely. Thank you, first of all, for having me. I'm equally excited to come here and to do this podcast. I know that we've been trying to do it for a while. So just to tell you a little bit about me, my name is Dr. Pooja Khanna, and I'm a consultant gastroenterologist and hepatologist working at King's College Hospital, Dubai. I qualified from King's College University back in 2000, and I have been working in the NHS for the last 25 years, and I've been working in gastroenterology and hepatology specifically for the last 20 years. I've been a consultant and a lead for the gastroenterology, hepatology, and endoscopy department at Luton Hospital for the last 4 years before I moved to Dubai.
That's amazing. You had an amazing career, 20 years in hepatology and gastroenterology. It's not an easy achievement. And so what made you curious about Dubai, and what attracted you to let go of the UK and come work here in the UAE?
So this decision to move to Dubai, it wasn't mine alone. It was a very careful, thought-out decision that we did as a family. So for a very long while, my husband had known that Dubai offered a real growth opportunity for him in his career, and he really wanted us to explore that possibility. And actually, I've had a childhood in the Middle East. I was brought up for a few years in Bahrain, and I really enjoyed that part of my childhood. It was safe and it was free, and I really wanted to imbibe that for my children. But I have to be honest, I was hesitant at first. I wasn't sure how easily my kids would settle. They've been born and brought up in the UK, whether they would, seamlessly settle into the environment here. And actually, I was only here as a kid, so I also didn't know what the professional opportunities for me would be like in Dubai. So I did what anybody would do. I went and did my homework, I did my research. I found friends of friends who'd relocated to Dubai. I'd found old colleagues who'd relocated to Dubai. I got in touch with them, and I spoke to them about their experiences here thus far. And I was really positively surprised. The feedback that I got was overwhelmingly positive. Everybody was very glad that they'd made the move. They told me that there were ample professional opportunities for me here in exactly the same manner as they would be back in the UK. I spoke to people with children who spoke to me about the education their kids were having. They told me about good schools with shining new infrastructures, teachers who've been trained globally, and, global standard international education that would stand my children in good stead. So having done all of that research, we then came to the decision that perhaps for multiple levels, for professional level, personal level, safety level, this would be a good move for all of us.
That's amazing. So your hesitation in the beginning, where you had some fears about the schools, you had some fears about the professional opportunities here, or whether or not you would get the same infrastructure or the same setup here. How does that compare to that and the reality here now, working as a professional, as a consultant gastroenterologist here?
So yeah, like I said, my two biggest fears were one for my children, and the second was for me. So actually for my children, it's been the smoothest journey ever possible. We went back to UK on holiday for the Eid period, and on the way on the plane there, my kid said to me, "Mummy, we are just going for a holiday, right? We don't want to live there. We want to come back to Dubai."
Yeah.
And I was really quite taken aback by this, just how well they'd embraced life here in Dubai. Dubai for children offers a childhood second to none. It's safe. It gives them independence. Here, I'm very happy for my kids to get on their bikes and go cycling in the community, meet friends locally, go to the pool, go to the park. They don't need me to have the added stress of organizing, structuring play dates for them, organizing and structuring their days. So they found this amazing independence and freedom, and it's allowed them to get some confidence in themselves. It's allowed them to be resilient. It's given them this cultural exposure to a really diverse population, where we live with about 60, 70 plus different nationalities. So, they went to camp and they came home and they were like, "Mommy, guess where this name comes from? And guess where this name comes from?" It has been a very enriching experience for my children, and they've surprised me with how resilient they are and how well they've adapted to the environment here.
Yes.
So I really needn't have worried. And then when it comes to my own professional fears, like I said, I really wasn't sure what the professional landscape here was like for me. And again, I've been very, very pleasantly surprised. I've been pleasantly surprised by the advancement of the medical infrastructure that is available, the organizational structure, how similar that is to back home in the NHS. I've been surprised by the fact that actually governance structures, things that are there to safeguard patient safety and to ensure that blessed clinical outcomes are achieved, exactly the same as back home in the UK. So there's nothing really different other than the fact that sometimes I feel that it's better.
Wow.
I feel that I have, access to better advanced diagnostics, better advanced therapeutics, none of the bureaucracy that sometimes goes along with the need to advance care in medicine. Sometimes in the NHS you get bogged down by a lot of bureaucracy. It can be very time consuming, and actually here there's none of that. So again, when I look back at my own experience, it has been a steep learning curve. I've only ever worked in the NHS before I came here. I didn't do any private work back home in the UK. So it is a very different structure, and it was challenging, and it was a steep learning curve, especially navigating insurance companies. It was a very big, a steep learning curve for me. But then again, I found that the hospital had lots of things in place to help me deal with that, to teach me about that. There was an infrastructure there. There was a nurse to help me understand what codes needed to go with what different diagnostics or therapeutic things. So there was a lot of help available to hand. And I would say that 9 months into my job, I feel quite settled. I was really quite impressed by the structure of the building, just how wonderful and advanced and friendly the whole hospital was. And I suppose the one thing that really struck me the most, which I wasn't expecting, was the familiarity. So King's College Hospital Dubai is based on, like I said earlier, exactly the same organizational structure, and I think really important for both doctors and patients, governance structures as there are back home in the UK. So, for example, there's an opportunity to be involved in the same quality and governance teams as there are back home in the UK. And these teams, they're aimed at ensuring that there is maximum patient safety, there's clinical excellence, there's performance monitoring. So all the things that patients need to feel reassured that their care is the best, and all the things that the doctors need to ensure that they're in a really supportive growth environment, all exist exactly the same as back home. I am now the chair of the Clinical Audit Committee at King's College Hospital Dubai.
Wow.
And again, this allows me to have a oversight role in the audits that take place at King's, make sure that they're done to international standards and that the aim is to continuously improve patient care. I've also recently been appointed as an adjunct associate clinical professor for the Gulf Medical University. Teaching is something that I've really enjoyed. So again, I've had this opportunity to do all the same things as I would have done back home in the UK, with the added advantage of having far more advanced structures in place for patients.
That's amazing. That's amazing. Gastroenterology is one of the highest demand specialties here in the Gulf, as you may have experienced as well. How does the pathology differ from what you've experienced in the UK?
So that's actually a really interesting question. So there is a real diverse diaspora here, and also Dubai obviously is a very big hub for medical tourism. So people come for the high quality medical care that Dubai has to offer from all around the world. So I have actually been exposed to things that I have only ever read in textbooks back home. So it has been a good growth experience for me. I've seen challenging cases, complex cases, perhaps that I wouldn't have necessarily seen back home. And this has actually helped enhance my skills as a doctor. So I've really enjoyed that experience.
So I would like to know, how was your experience with Allocation Assist? What did the journey look like for you?
So just going back to the steps, saying that, I spoke to a lot of colleagues here to find out what it was about, what it was like to do medicine here, and they were very kind to point me in the right direction towards Allocation Assist, because you're absolutely right. Back home there's usually one portal website, and you can go to that NHS portal and you can see all the jobs that are advertised in your specific field, and you can apply for those jobs. But that isn't the case here. And when I went on the net, there was nothing that I could find. I read about different licenses, but I didn't understand the differences about which license to apply, how to apply for it. But luckily, like I said, I'd spoken to people who said to me the simplest and the only way of doing things was to go to allocation assist. So that's exactly what I did. I was a little bit hesitant at first. I was like, I've never, like I said, back home in the UK, you don't have a recruitment agency to go to.
Yeah.
So I was a bit hesitant, skeptical of that concept. I was like, how does that work? But actually, after the very first conversation that I had with Emily, the founder of Allocation Assist, I was very reassured that this was exactly the right thing to do for me. She was very supportive. She was very informative. She was very friendly. And, she told me, because I had no idea, had no idea about salary structures, the kind of hospitals there are, the different tiers of hospitals, how you would go about getting a job. So I think, it was very, very reassuring to have a conversation with her, and she reassured me that she would handle everything. And actually, the rest of the team was equally responsive, equally helpful. If I sent a message, somebody got back to me with a prompt reply. So this was really very easy to navigate. But I do believe that if you don't do that, it can be very difficult.
Yeah, very difficult in a sense, in terms of timeline, in terms of...
I think in terms of understanding the licensing process, I think that licensing process is quite complicated. And, luckily, I didn't have to do any of that. So that's first. But also in understanding the different kinds of hospitals and which hospital might suit you best. I really had no understanding of the sort of healthcare system here. And I think Emily did the right thing and found me the absolute right job for me. I feel really a home in King's Hospital Dubai. It's the right hospital for me. And she did very well in understanding my skill set and my personality. And she placed me in exactly the right hospital.
That's amazing. Thank you so much, Dr. Pooja. If you're a Western-trained doctor ready for more, message Allocation Assist Middle East today for a full consultation on salaries, contracts, and medical license in the UAE, Saudi Arabia, or Qatar.